Hi, this is Reverend James Crook. I'm here to help you with your obsessive compulsive disorder with a psych system. Now, this is existing psychology that I've pieced together to be practical and in helping your OCD, depression, and anxiety. Now, I have a story to tell you. I was 9 when I developed OCD. I've had it for 40 years. I'm 49 now. And it's in remission and it's gone. I don't feel any anxiety. I'm still on Paxil just in case, but it's inconsequential. It's helping, I guess. But that's it. Anyway, it works. My system works. It took me a long time to develop it. It was a slow process for me to get better because I had no one to help me. I was studying this on my own because doctors and psychologists in my lifetime failed to do their job to diagnose my OCD. I had to treat it myself. And I got a general practitioner to give me Paxil. So, no much for psychiatrists, except for this one agrees that I do have OCD, after all, and has allowed me to have Paxil, and it's given me a bit of Seroquel to help deal with the anxiety if I need it. And that's all there is to it. Now, I'm going to start off with a psych system for you. Now we're going to start with cognition. Cognition? Okay, let's start with mindfulness. Okay, I want you to be full of mind. Okay? Now, to be full of mind means to be mindful. So be full of mind and be aware of what's going on in your head. And be aware of your behavior and what's going on really in you in real time. Now, okay, to be mindful of what's going on in your head, you have to be mentally aware of the mental processes that's going on up there, of knowledge and things. It's all problem solving to emotions and even behavior. It's everything that works on in the head. Okay, even eyesight is a matter of cognition. Smell, taste, hearing, touch, it's all cognition. Okay? Executive functions, memory, things like that. And it's all the functions of your brain, of your mind. And that's cognition. Now I want you to test that out by using your emotions and how you feel to access your mind, to observe what's going on in your mind, to see what's happening, and get a good idea of what's going on in there. Get a picture of everything that I said that goes on up there. If you see it, if you note it, if you detect it, if you can tell anything going on up there, practice, make perfect. Okay? And just use that mind of yours to observe your mind. Okay? And your gut, your emotions is basically what's going to help you do that. Now, after you've done that, okay, you know your cognition. Okay, that's the main point. And that does cause your emotions. Now, for emotions, you want an emotional intelligence. Okay? Now, emotional intelligence, that in a nutshell is basically being aware of all your emotions, what they are, labeling them, knowing what they are, because they are information, by the way. Emotions are information. They tell you what's going on in your environment or what's going on in your head. Now, emotions are important, and they are the center of what makes you psychological. Without emotions, you really would have no reason to do anything. Correct? So, emotional intelligence is just basically noting emotions and the behavior they cause. Okay? Now we go on to behavior. Behavior is learned. Okay? Learning is behavior. Okay? There's two different ways to learn. There's classical conditioning, which is like Pavlov's dogs. Okay, I'll give an example. Okay, they're fed meat powder and they salivate. But then Pavlov learned that if you ring the bell before you give food powder, the dogs will salivate because they associate the ringing of the bell with the food powder. So even without the food powder, when you ring the bell, they'll start to salivate because they associate the food, so they expect the food to come. So they salivate. It's like me saying relax, and then I set off a firecracker right in your face. Okay, right there in front of you. And I say relax, and bang! Relax, bang! Relax, bang! Okay, after a while I just have to say relax, and you're going to flinch because you expect a bang. That's classical conditioning. Now there's a counter conditioning thing going on, where if you're classically conditioned, you can counter condition it with another condition that feels much better, a better state. Okay? Say like you were classically conditioned to flinch when I said relax. Now I could get you to relax, okay? I could get you to relax, and then when I say relax, okay, that flinch or that bang you expect won't happen. You understand? You'll get used to the bang kind of thing, the flinching. So if you're conditioned to flinch at the word relax, you'll relax at the word relax and get over that expectation of a bang as counter conditioning. There's a systematic desensitization which goes on with classical conditioning. Okay, that's like, let's see, well, say you're phobic of something, okay, like spiders, or heights even. So you're phobic of heights. So basically what I get you to do is relax and get into a really deep relaxed state. Then I get you to imagine from levels 1 to 100, 1 being least and 100 being real time actual exposure. You'll get a level 1 exposure to a level 5 exposure, slowly increasing the intensity of your exposure to your phobia until finally you're imagining yourself at level 100, slowly, gradually getting used to relaxation, counter conditioning. See, that relaxation is getting rid of the anxiety as you're exposing yourself slowly to the heights. Okay, so you imagine it in your head, and that's as good as the real thing, really, because your brain doesn't understand that difference. It doesn't understand imagination to reality. Okay, so then once you're desensitized, classically conditioned to be desensitized to the phobic heights, you could probably approach a scenario or a situation where you're exposed to heights and it won't be as bad because you were counter conditioned to be relaxed at that point. So the anxiety doesn't get you. You could go into an elevator, go up an escalator, be at the top of a building, and look out the window or look down from the window and not freak out. Or you could look over a ledge and not freak out. That's counter conditioning. That's classical conditioning and counter conditioning. Now, you also have operant conditioning. Okay, that means in operation of your behavior, it gets reinforced. Okay, there's a negative reinforcement and a positive reinforcement. Okay, a positive reinforcement is rewarding good with a good, or taking away something bad, or a punishment, taking away a punishment, and getting something good out of it. So it's giving good and removing something bad to get good. That's positive reinforcement. Negative reinforcement is the opposite. It's removing something good to get something bad out of it. That's a punishment. Or a direct, noxious reward, which is a punishment. Okay? So now you have both. Now what goes along with reinforcing, okay, after you do something and you learn that this is reinforcements, okay, you can also be shaped. Okay, and shaping means the closer you get to a desired behavior, you're reinforced. The more closer you get to it, the more reinforced you get until you're actually doing the behavior. Okay, now it could be the opposite, not doing the behavior that you don't want the person to do. If you don't want a person to behave like a dog, if you want a dog to stay away from the cat, you can shape him by punishing him for getting close to the cat or removing something good. So the dog slowly learns to stay away from the cat until it's actually staying away from the cat. Or another way of doing it is to reward him whenever he does stay away from the cat. So the more he stays away from the cat, you reward him. Or you remove something bad so that it's a good situation. Like you take him away from being grounded. You can ground a dog, you can ground a kid. You remove the grounding, that's positive reinforcement. That's shaping. Slowly getting the person or the animal to do or not do the desired behavior that you want them to do. So that's that. And then there's partial reinforcement, which is basically to get consistent behavior, which is hard to extinguish, but it's to get consistent behavior. Like a kid, the more or less keeps nagging mom, I want to sleep with you, mommy. Let me sleep in the bed with you. Let me sleep in the bed with you. Come on, mommy, please, please, please. Mom says no, 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 and finally she says yes. That's all the kid needs. Now the kid's being partially reinforced to know that if he insists, he will get to sleep with mommy. And that's partial reinforcement. Consistent behavior with a varied reward or varied reinforcement. A varied reinforcement. You could actually get somebody to do something you don't want them to do with a varied reinforcement. Or you can get them to do something you really want them to do with varied reinforcement. And that's behavioral conditioning. Now we're going to get down to cognitive behavioral therapy. Cognitive behavioral therapy is really using your mindfulness to observe what's going on in your head, to know what's making you feel. Okay? So when it comes to your compulsive urges or any stress that you're doing, any stressful behavior that you're doing, okay, you anticipate that stressful behavior. Okay, that compulsive urge to behave, okay, obsessively, okay, you anticipate that and you accept it, okay. Now, when you have done that, you change your behavior. You don't do the compulsive urge, you do the opposite. You confront it, okay. That's basically where I feel compulsively urged and I accept it, but I don't do it. And in that sense, I learn here that it's nothing but garbage signals in my head, and it really doesn't do anything to me. I don't die from it by not doing the rituals. I don't die. And you can't die. You cannot die. It's just your brain going ow with anxiety. Okay? Your brain jams, gives you an error signal saying that there's something not right. The thoughts are jamming. And so you get the anxiety, and the compulsive urge is basically the result of this to try and get rid of it. But you're doing the wrong thing. You're reinforcing it to continue. So what you do is you do the opposite. Okay, you don't do the compulsive urge, and then you'll learn that it's just an obsession that has to pass through and then wears off. And that's a lot of anxiety and stress to have to deal with. And really, you might find the thoughts invading your mind, like you're aware of your thoughts right here kind of thing. And it's annoying. And you want to get around them so that you can want to concentrate on what you're doing and not have to deal with the thoughts all the time and think about them. And it's really done with your emotions. Okay, you can get around those thoughts with the way you feel. Okay? It's tricky, but you can do it. Now, how I did it was I managed to just think my way around the obsessive compulsive thoughts, and I used my emotions as a guide. and then I was around my thoughts and my emotions. So I was in front of the whole disorder, not behind it. Now there comes a mind operating system. Okay, the mind operating system consists of a psychology. Now, it's a psychology that I got from a psychiatrist online. Okay, basically, I have the permission to use it because I got it from another guy named David D'Angelo, who used it for his deep inner game for dating and attraction. Now, this is the deep inner game, basically. And it's a mind operating system, okay? Anyway, it goes like this. You have freedom, time, and love as internal resources. Freedom comes from a wisdom, okay? So you have the freedom to be wise. That wisdom is your conscience, or superego, and your gut instincts, or id. Okay? Those two together in balance is your wisdom. That wisdom gives you the freedom to decide. And we all want to decide. If you have the freedom to decide, you're fine. Now, time comes from a genius. That genius is gotten from an education and an experience. Together, the education and experience combined together in a well-balanced area gives you your genius. That genius gives you time. And that time is for intellectualizing, like intellectual thinking, ideas. Not intellectualizing, that's an ego defense. No. Intellect, ideas. So you have the genius, the education and experience to have the genius for the time to have ideas. Now, love comes from happiness. Happiness is gotten this way. Okay, first of all, you have to expect the fact that you're going to feel angry and you're going to feel anxious. Now, that's the spectrum. Everything in between anger and anxiety, okay, is within a spectrum of anger and anxiety. Like paranoia is a form of anxiety, and boredom is a form of anger. There's different kinds of anger and different kinds of anxiety. Now, what causes anger is a hurt, the stress of hurt. Now, hurt will make you angry. And the best way to deal with anger, okay, is to believe in yourself, to be able to be assertive, okay, and patient to get your needs met, okay? And that's striving for a win-win situation, not a win-lose. You don't want to seek revenge. You want a win-win outcome. So you assert your patience to get a win-win outcome for your well-being. That's part of your happiness. Now, on the other side is anxiety. Now, anxiety comes from a loss, okay? And you have to be brave, okay? You have to believe in yourself to be brave and do the right thing in the face of anxiety for your confidence. Then you'll have your well-being and confidence, and that makes your happiness. That happiness gives you the love for self-esteem. So now you have decisions, ideas, and self-esteem. Wisdom, genius, and happiness, and freedom, time, and love. Now, freedom, time, and love is what you feel on the inside. Those are your gut. That's your gut. Okay? That's how you feel. That's your internal resources. Now, all you need to know is to have a boundary. Okay? Now, if your personal boundaries are wide open with holes, okay, anything can come right in and stress you out and be a problem. You don't want that. Okay? And you don't want to be a wall to anything from the outside because you starve. So either you're open for abuse or you're starving yourself off and dying. So what you want to do is install doors to the holes and keep a door open to spend your freedom, time, and love for good deals. Okay, so you use your freedom, time, and love to get good deals for yourself, which adds to your wisdom, genius, and happiness. So you're able to decide, have ideas, and have self-esteem. So freedom, time, and love is spent through your door, your boundary door. patch your boundary holes. Just say no. It's a preference to things outside yourself. Okay? Say no to trying to control things outside your boundary, because you can't, and you'll suffer if you do. Try. It's like lifting a weight emotionally that you can't lift. You're going to have a problem. So don't bother with that. Okay? Stay within your boundaries and control what you can. Now, install doors. Okay? Now say yes to the good deals, potential good deals in that, and say no to the bad deals. Yes to dogs, no to cats. If dogs aren't your type, then it's no to dogs. If cats are your type, then it's yes for cats. Understand? It's not just animals here, you know. Like, I could be on your case right now, and you may not like me, and you might say no to me, and just shut me off. That's a good deal for your internal resources. If it's stressing you out, if I'm hurting you, or it's a loss, cut me off. Just, that's it. Stop me. And that's all you have to do. Yes or no. For me, it's always yes for a good deal, and always no for a bad deal. And I just look around, and I can tell what's a good and bad deal. And if I have inherent established boundaries that are all bad deals, I'm going to change them. Okay? And in essence, all of that is your character. Now, we have done cognition, emotional intelligence, behavior. We've done cognitive behavioral therapy. We've done the mind operating system. Now we're going to do a little Sigmund Freud. Okay? Now, I told you your conscience is your superego, and your gut instincts is your id. You could say your gut instincts is your intuition. Okay? So, leaving it at this, okay? OCD is basically your superego or your conscience getting on the case of your gut instincts, or id, thinking that the id is out of hand or whatever, and is trying to stop losing control of the id. Okay? Your superegos are afraid to lose control of your id. Okay? Your conscience is afraid to lose control of your gut instincts. Okay? Now your ego, okay, feels the pain from your id because of your superego. Okay? Your superego don't like the id. So when the id comes out, it intrudes on you a bad feeling like, ow, I don't like that. Oh no, I gotta do something to prevent it. Another thing is, you don't gotta. All you gotta do is basically condition your superego or your conscience to let the gut instincts be. Okay? And you'll feel better that way. And trust me, that is profound. Get used to that. Now, all I have to say is, you will probably be feeling very depressed at this point too. Now, depression is just an attitude, okay? Now, you gotta change your attitude. You gotta condition your attitude to get over depressive thinking. It's a bad attitude. You understand? You have a bad attitude about things, and you just get down on everything, down on yourself. Okay, that's a bad attitude. Piss poor attitude. Change that attitude. Start thinking up. Start thinking positively. Change the stories you tell yourself. Okay? The bad attitude, a badass attitude of stories, negative stories you tell yourself, that just teach you to be helpless. Okay? That's what depression is. Learned helplessness. It's like a puppy being stuck in a cage with an electric shock, and it keeps buzzing electricity, and the puppy can't escape. No, that's cruel treatment to a puppy. But, you know, these scientists did that. And the puppy just gave up and laid down and absorbed the shock. Then they take that same puppy and leave the cage open and give him the same shock. The puppy doesn't even see the open cage. He just accepts the fact there's no hope. So, he lies down and cowers and takes the shock anyways, even though he can get out. That's learned helplessness. That's a bad attitude. Okay? You might have had rough times in your life. It may have been a past hell, but the thing is, change your attitude because there's a way out now. There's always a way out. Okay? So, lose that depression and get a badass attitude of a good deal for yourself, thinking right. Okay? Now, that's really all I have to say for OCD and depression and anxiety. Now, you might want to learn confidence, okay, and get used to that confidence. Okay, but that's normal confidence is what I taught you how to deal with, and normal anger, okay? But you, as an obsessive compulsive disorder sufferer, might feel an intense rage boiling inside you, and you're afraid to get angry. You don't want to get angry. As a matter of fact, you don't get angry, right? Well, trust me, that rage isn't serving a purpose. That rage is feeding your anxiety, your intruding thoughts. That's not good. You gotta get rid of that rage. Badass attitude. Remember that. And normal confidence, but the anxiety that's coming from your brain has nothing to do with normal confidence or normal anxiety. It's a pain, okay? It's a definite pain from your brain. Scientists say that the brain feels no pain, but I disagree. If you hurt the brain in any which way or form, or if the brain's sore or aching or hurt, you will feel it as an emotion. That's where you feel the pain. It can be quite subtle. Now, you're going to have to learn to deal with that anxiety pain. Luckily, it has to do with the depression that I told you how to deal with. Okay? Now, I'm not telling you what to do. I'm giving you skills. Okay? I'm not telling you to do anything. This is my personal opinion. Okay? You are responsible for your own behavior. I'm not telling you to do anything at all. Do this, use this at your own risk if you want. But it works. It works for me. It'll work for anybody, really. But I highly recommend you get on medication. Okay? Now watch out for the benzodiazepines because those things are addictive. You don't want to get too used to those. Okay? But get on the Paxil or the Luvox or the Prozac or Effexor or anything, really. Just get on that stuff. Okay? Now, I'm not meaning to rush on and get it. You may be against it, actually, because of the side effects. But it helps. Okay? Medicine is the training wheels, and what I've given you just now is the bicycle. Okay? Pretty soon you won't need the training wheels, probably. But while you have the training wheels, take them. That's what the pills are. And the pills can help teach you how to be, as obsessive compulsive, to not be obsessive compulsive. Let the pills help you, condition you, so you'll learn from the pills. Now, I have 1 minute and 30 seconds left, so I'm going to give you the rest of my training and tell you to go study Neuro-Linguistic Programming for Dummies. Now, it's not for dummies, really. It's a pretty intense book. But get the Neuro-Linguistic Programming for Dummies. And just remember, NLP is basically this, okay? You have a subjective experience, okay? Right now, I'm the object, and you are the subject, and you are having a subjective experience with me. And basically, all that's coming into you is a language, okay? It's all a language. It's a process of language. That's the structure of your subjective experience. It's all the language that's coming in at you at one time, okay? Now, what you make of it will affect your internal state, okay? And you can program this language, okay, neuro-linguistic programming. You can program this language to be any which way you like to help you out, okay? Now, go study Neuro-Linguistic Programming for Dummies and get the most out of it. That's an amazing book. All right, take care. God bless. Reverend James Crook, out. Goodbye, and good luck.